Hi, I'm Bernie Flynn. At New Jersey Manufacturers Insurance Company, we believe that all citizens need to be informed about the important issues that affect their daily lives. That's why we're proud to support programming produced by Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community. United Water, making the planet sustainable is the best job on earth. Horizon Blue Cross Blue Shield of New Jersey. Activists in cooperation with the American Medicine Chest Challenge. NJM, auto insurance, homeowners insurance, and more, with a focus on safety and financial stability. The Russell Berry Foundation. And by Choose New Jersey. Our mission is attracting companies to the Garden State. Promotional support provided by New Jersey Monthly, the magazine of the Garden State, available at newsstands. And by Commerce Magazine.
Welcome to Caucus, New Jersey. I'm Steve Adubato. You know, the Affordable Care Act, or so-called Obamacare, is in full effect. It is clearly having a very big impact on the healthcare system, including the need for more advanced nurses. Here to discuss the expanding role of nursing and the bigger healthcare picture, we have Judy Schmidt, who is the president of the New Jersey Nurses Association. Dr. Sheryl Slonim, chief nursing officer at Holy Name Medical Center. Melissa Sirola is an adjunct professor in the Department of Nursing at Caldwell University. And finally, Maureen Sweeney McDonough, Vice President of Administrative Services for the Newark Community Health Centers. I want to thank all of you for joining us. You know, right before we get on the air, and by the way, there's going to be a lot of great information in terms of websites you can go to get more information. Right before we got on the air, I said, you know, the ACA, the Affordable Care Act, otherwise known as Obamacare, it's expanded the role of nursing. And some of you have said, nurses have always been very important. In fact, in some ways, we're not in charge, but we drive a lot of the healthcare system. Fair to say?
That's very correct.
Talk about it.
I think nurses have really been at the forefront because we're the ones that take care of the patients, the ones that are at the bedside, the ones that tell the doctors exactly what's going on with the patient and consult with the physician on what the right treatment plan is for. And that's with nurses with bachelor degrees that do that. Advanced practice nurses take it a step forward and begin the treatment for the patients.
Well, what exactly is an advanced practice nurse?
Well, it's someone who has advanced education.
Come on, let's talk specifically.
Okay, so
a nurse. Okay, break this down for us.
Okay, so
levels of education.
Master's prepared.
Okay.
At least master's prepared, going for the Doctor of Nursing Practice model.
Okay.
As we move forward in the profession, but just to make it clear, so the bachelor's nurse is really the bedside nurse at first, and then as they advance their degrees and get to the master's level, they can become an advanced practice nurse.
Does the new law does the federal government, through the ACA, the Affordable Care Act, require that nurses have greater education?
No, it doesn't.
It doesn't.
It just increases the need. As 300,000 New Jersey residents have now gotten insurance on the marketplace, there are more people coming into care, and the need to be seen is there. So a lot of, like for Newark Community Health Center, we're at capacity. So you're looking for more advanced practice nurses to assist the physicians and to work to provide wellness and prevention and things like that, as more people are now coming in for services. So the need, for advanced practice nurses is definitely there.
It's a much more expanded role now. There's much more expanded role now for nurses. The education is changing. We're bringing them up to the level of a doctorate level in their education so that they can go out and practice much more independently, because the need is there for them to practice independently. And I think we have to stop thinking of them, even our BSNs, as bedside nurses. BSNs.
Bachelors of Science in
Nursing. Do you think we all know the acronyms? Excuse me.
There's so many in nursing. A Bachelor of Science in Nursing are what should be the entry level, and that's been debated. We talked about this since the early 60s. We haven't been able to establish the BSN as the entry level for nurses. There's still other ways to get into the nursing field. But even the bachelor's nurses are not bedside nurses because the jobs are not at the bedside anymore. The jobs are out in the community. The jobs are in so many diverse locations that we tell our students don't expect to go into the hospitals. When all of us graduated from nursing school, we all went right into the hospitals. Those jobs were waiting for us. We went. You literally showed up and said, what unit do you want to work on? And we went to work.
You make it sound like nursing isn't nursing anymore.
Well, it's very different.
Nursing,
it's a different
just
model.
different. We're doing, in home care, we can do almost a full ICU type treatment for a patient in the home.
And 30 years ago?
Couldn't
20
happen.
years ago?
Not
Couldn't
even
happen.
possible.
In the hospital.
Not even possible.
No.
No.
The technology wasn't there.
Yeah, and as
technology,
healthcare moves from the fee-for-service, the healthcare
Say it again,
industry,
since
as
we move-
healthcare moves from the fee-for-service model to more
Explain
a
what that
value.
means, fee-for-service model. You
Well,
come in and...
a typical, you get paid for the services that you provide.
Got it.
As now it's more a value-based payment with all of these accountable care organizations and these initiatives. You're getting paid to keep people out of the hospital. So decrease length of stay, decrease admissions. Therefore, the role of the nurses is not the traditional at the bedside. It's more outside in the community, keeping people out of the hospitals, which provides different challenges.
So you're actually required to be a different kind of nurse.
Yeah.
Talk about it.
Well, we're actually judged by patient satisfaction and by our core, at least in the acute care setting where I'm working, we're judged by our core measures. How
You do
well
core measures.
Core
Explain what that
measures.
means.
Core measures are our quality indicators for how well we do with certain diagnoses. So we're being reimbursed, and we're being
By whom? The federal government?
By the federal government, the payers, by how well we make our patients happy and how well we score outcomes. We're judged on outcomes.
And so how does that change the job of a nurse?
Well, the nurses clearly have to work quicker. They have to be more astute. Their critical thinking skills have to be more exact because we need to move the patient through the system swiftly and safely with quality as the overall goal.
So I'm curious about this. For someone who went into nursing, there's two different things I'm thinking here. One, with the change in the federal law, the Affordable Care Act, and we're doing this program as we go into November of 2014, the second enrollment period is happening on November 15th into February. But there'll be more people enrolling, which means the demand will be even greater. But I got two things going on in my head. One, for the new nurses who come into the profession, at least they have an idea or they think they know what the nursing profession is going to be under the new guidelines. But what about for the nurse who's been around for 20, 25 years, if not more? He or she now is having to adapt to this new healthcare environment. How challenging is that for that person?
I think it's very challenging, but I will say that nursing will not change. Nursing is assessment, it's planning, it's implementing an evaluation. We call that the nursing process. And it doesn't matter what setting you're in. If you're in an acute care setting, you're out in the community, you're doing navigation. Navigating means taking the patients through healthcare is very complex. It's a very complex process. There's lots of opportunities, lots of places to go. There needs to be someone to guide the public on how to get through healthcare. And we want to become a more healthy environment. That's what nursing is all about.
So as a patient, let's look at it from the patient's point of view. First of all, do we as patients, most of us think it's simpler than it really is?
I think you do.
Until you
have an
experience it.
illness, and then you realize how complicated it is. Such as a woman who has breast cancer. When she gets the diagnosis, she's stunned, doesn't know what to do, doesn't know where to go. It's the nurse that's going to navigate her through the process of making her appointments.
It's not the physician?
It's usually not the physician because he's so busy running
He or she
from one patient to another. It's the nurse that's going to make the appointments with the patient.
He or she is the navigator.
The coordinator of
The
care.
coordinator.
It's our.
The nurse is I hate to use the football analogy. The nurse is the quarterback?
Absolutely.
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 But does the role of nurse quarterback change with the advent of the Affordable Care Act? Is it harder to be a quarterback in this?
It becomes more complex.
Because?
because there's so many avenues that you need to take in order to move the patient through a continuum of care to focus on wellness rather than trying to, affect changes from a disease-specific state. We want a wellness-specific state.
And focus on outcomes. So say you're talking about nursing education. So how does then nursing education change when you're trying to get students ready to go out and be this kind of nursing quarterback, if you will, in this incredibly complex environment that he or she's never even faced in the first place?
So the curriculum changes.
The curriculum, absolutely.
Is the curriculum changing in nursing schools as quickly as, jump in?
Absolutely. There are courses now. There are courses in leadership that were never taught
Healthcare
when
policy
we were.
was never taught.
Talk about
how to be a nurse leader. How to
be a nurse leader?
Yes. What is leadership? How do you lead
and hold on,
other
back
nurses?
up, devil's advocate. Someone says, I signed up for nursing. I didn't sign up for leadership. I signed up to be a nurse.
And all nurses
If I
are
wanted to
leaders.
sign up for business school and get a leadership course, that's what I would do. You say?
See, the change is when we were in nursing school, we were told, go and take care of the patient and don't think of anything else. We were told to take care of the patient, make them happy, and do the disease-specific things that were part of the nursing process.
Right.
Now I take the nursing process with my students and I teach them how to advocate for healthcare, how to navigate through the healthcare system. They have to understand who the payers are, because that's going to affect not the care that we give, but where it's given, how it's given, the reimbursement, and all of that. So
what does that have to do with
need to know
leadership?
that. They need to be leaders in this environment and understand how to take the patient through that and how to be the advocate for the patient. They need to understand how to lead.
They're not only the person that was directed to, they're now the directors. They're navigating, they're bringing the patient through, they're leading the way. It's not the leader as in nursing where it was a manager of a unit. It's now the nurse that's the manager of the patient with the health care.
Does it require, and it's so interesting because I do a fair amount of, outside of this work, my other part of my life, professional life, is do a lot of leadership development. I love working with nurses because I do find them to be natural, I shouldn't say natural born leaders, but naturally responsive to leadership coaching. And they do understand the need for being, the need to be a leader. But here's what I'm struck by. Do you feel that there is a need to be even more assertive? I'm bordering on the word aggressive, but I don't want to use it here. More assertive than ever before in this current post-ACA environment. As a nurse leader, the need to be more assertive as an advocate on behalf of patients as you navigate the system. More assertive as you're communicating, negotiating, navigating on behalf of patients. You believe that?
I do believe that.
Talk about it.
Well, I think that you definitely are the voice of the patient, and I think people who are coming into the healthcare system have more now that don't have experience navigating the system, so they really don't even know where to begin. They're at square one. So you really do have to take these newbies, for a lack of a better word, from point A to point Z.
What makes it particularly challenging to navigate in this environment today?
It's very fragmented, the healthcare.
Fragmented. What does that mean? Break it down.
The care is moving from that silo to now the new paradigm shift, which is the continuum of care. So before
We're using
there
phrases
was
like continuum of care. I don't think the average person even knows what that means.
Let me explain that. So we're together working with physicians in, say, the ACO environment, okay? The Accountable Care Organizations, okay? So physicians and hospitals are forming relationships, bonds that before didn't exist.
Back up. Hospitals and physicians weren't on the same team before?
I can make a wonderful analogy.
Go ahead.
I wish I could take credit for it. I was at a conference and I heard it. But you know what parallel play is with children in a sandbox?
Go ahead.
Parallel play. Two kids playing together.
Yes.
They're playing together in a sandbox, but they're really not playing together. They're playing side by side. That's how physicians and hospitals have always worked. Now, because of affordable care, we're bound to join together and become partners.
You have no choice.
Because of the way the healthcare system is being driven. It's a totally different paradigm.
How's that working?
So far, well, that's why I said to you at the beginning of the show, the jury is out, because we're seeing how that's working. It's new.
And what is the role of nurses in the what was formerly parallel play, as you argue, between hospitals and physicians? And then where is the place for nurses in this?
To knit the entire system together for the patient.
You're the glue?
We are the glue.
Absolutely.
And the physicians, most, I don't want to generalize, from your experience, I know it's anecdotal, I don't know what studies are out there on this, it's too soon. Anecdotally, do you find most physicians responsive to the role that nurses play, as you describe, as being the glue, as being the quarterback, the players who keep things together in the sandbox?
Many do.
Most do.
I think they have to, because
They have to.
because things are changing so rapidly, and they've gotten so busy that they have to rely more and more on the nurse and enable her to do more, and him or her to do more and more independently.
So nurse practitioners, which are
advanced practice nurses.
Are most physicians supportive of the idea of nurse practitioners doing more in terms of actual clinical procedures that had previously only been done by physicians, but now there aren't enough primary care physicians? Are most physicians saying, yep, let's have nurses do those things because we need them? Is that what we're hearing?
It depends.
It depends.
It really does.
Well, what's the law right now?
It really does
The law is
depend.
that you can't do it.
Well, it's changing. The regulations
Right
are
now,
changing.
can most advanced practice nurses
Practice
right,
independently?
Yes.
practice independently?
You just have to have a
You have to have
collaborative
a
physician.
collaborative-
Oh, you have to have the physician sign off on certain things.
Well, you have to have a collaborative
agreement.
agreement so that you don't have to work in the same place at the same time.
Okay.
But you have to have somebody, if you need to have a question, that you can pick up the phone and run something
make
by
sense?
them. Yes, it does.
So it's working.
It is working.
Doctors and nurses love each other, don't they?
I think by and large, yes.
By and large,
They do.
They're a good
They do.
team.
Most of the time.
we're a good team.
Okay, so you have to work together on behalf of the patient.
Absolutely.
So
Patient comes first.
as we begin to wrap up the show, I'm curious about this. On behalf of the patient really actually doesn't want to know any of this. You know that, right? The patient doesn't want to know what's going on with the hospital, the medical staff, the nursing staff. They only want to know, are you going to help me? Are you going to help my family member get better?
And that's what nursing is.
And that's what nursing is.
Go ahead.
Absolutely. Nursing makes that seamless so the patient doesn't even realize they're being moved through the system. And it makes it as easy as possible for the patients. That's the core of nursing.
The coordinator of all the care.
And that hasn't changed. That's been consistent over the years.
It's just the setting that's changed. We've gone from an acute care hospital environment to a community-based environment, from a chronic illness to a wellness
Prevention.
and prevention.
And prevention.
Well, hold on, but where is the place for people who are still chronically ill?
They still are, and nursing will still continue to help those chronically ill patients to hopefully move them towards a more wellness-based, so that they're not going back into the hospitals every 30 days, that they're being taken care of in the community by physicians, advanced practice nurses, and other healthcare professionals in the community setting and not in the hospitals.
Because you're also reimbursed or not based on the degree to which a patient who has been treated at a hospital goes back to that hospital for the same diagnosis or
Diagnosis.
not.
Utilized.
Help us understand that. What's that all about?
That's part of the Accountable Care Organization and the rules that are coming down through Medicare and Medicaid for all-cause readmissions within 30 days. That if you're readmitted for the same diagnosis within 30 days, the hospital won't be reimbursed for that, or the physician. Or if you have any admission for what they call ambulatory sensitive conditions around heart failure and COPD. So
COPD?
chronic obstructive pulmonary disease. So basically, the payers are saying they're making the lines, drawing the lines.
Payers meaning the federal government?
The
insurance
Medicare, the
companies.
insurance carriers, Medicare, Medicaid are saying what they will and will not pay for. So they're really dictating how people practice, how hospitals practice, how providers practice, whether it's nurse practitioners or physicians. And the shared savings, like through Medicare, and Holy Name is an ACO, are paying the shared savings based on these quality metrics, and if you hit them or not. So it's really driving how nurses' roles change, too, to dot the I's and cross the T on those different quality metrics, because there's a dollar attached to it.
So could we use CHF, which is congestive heart failure, as
Go
an
ahead.
example? So we discharge the patient, we move them through as quickly as possible, right? Based on what are the recommendations
Best
are,
practices.
and best practices, gold standards, and so forth. We discharge them, they go home, but they go to a home that perhaps has hot dogs in the refrigerator and canned soups
Their
in their own home,
Well, you can't control what they do in the home.
which is where the nurse comes in.
Where? What does the nurse have to do with
Because
that?
the post-acute services nurse, which may be home care, can go into the home, evaluate what's in the home, go into the cupboards, see what's high in sodium to keep that patient out of the hospital and safe.
That's the role of a nurse in the
Absolutely.
post-ACA environment.
Absolutely.
Today it is.
We have a, hold on.
Safety checks,
Don't we have the
environment of
nursing
care, all of
shortage?
that.
and let me ask you, do we have enough nurses to do what you just described?
Right
To go
now,
into people's homes and to help monitor what they're eating, how they're living, and whether they're doing the things necessary to reduce the odds that they will come back to the hospital because they've done the wrong thing.
It's happening now.
it's happening now.
And it's also being supplemented by telehealth, where we can put monitors and different types
Scales in the home.
Scales, blood pressure machines, where they can take their blood pressure and it gets
iPads.
transmitted directly to the nurses so that we
Tablets.
can do it. So there's all this technology.
How much is technology driving all this?
A lot.
A lot, absolutely. When the technology didn't exist, the patients stayed in the hospital because we couldn't do this care at
Because this
home.
technology was in the hospital.
We have ventilators that we can put in patients' homes now, which didn't exist. We have small little ventilators that I can put on a 4-year-old as a backpack and send them to school. That didn't exist 20 years ago.
But how much, even though nurses are playing a greater role than ever before when it comes to healthcare and the post-ACA environment, doesn't this also say that a large part of the outcomes that patients experience falls on patients?
Yes.
I mean, and why don't we be
People have
candid
to be
about the fact that
responsible.
a lot of folks out there are saying, help me get better, doctor, help me get better, nurse, and if I don't, somehow you screwed up. I mean, no, seriously.
Can't do that anymore.
It's about setting self-management goals for the patient and finding out what's important to them.
Talk to folks about what you do in your organization with respect to that.
It's all about patient education and trying to determine what's important for the quality of life for that patient.
Is it harder to do in certain communities?
It is, absolutely.
Describe that.
Well, it has a lot to do with their health
Describe where
literacy
you
level.
serve.
I serve in a Newark community, so we have 7 health centers, 5 in Newark, 1 in Irvington, and 1 in East Orange.
All urban.
And it's definitely
Harder to do this in urban communities?
definitely harder.
Because?
The health literacy, the literacy levels, the educational levels are lower.
What would be the correlation between, as you're calling it, health literacy and health outcomes?
There's a big disparity between the two
Because?
because there's a bigger need to educate, and these are a lot of an immigrant population, new to the country.
Language?
Barriers, a lot of Creole speaking and Spanish speaking.
Cultural issues with
Cultural
diet.
Yes.
Does it make the role of the
diet.
nurse even greater in such a situation?
Absolutely. And in the health centers, there's less RNs, registered nurses, and a lot more LPNs.
Explain that in the health centers in the few minutes we have left. There are fewer.
Registered nurses, bachelor prepared, so you have more that are licensed practical nurses. Due to budget constraints, it's just part of it. So in the hospitals, you see the registered nurses at the bedside, and unless you have experience, you can't get a job in the hospital.
Wow.
So it's a bit of a vicious cycle.
I think we're in a transition period.
What does that mean?
We're an acute-based healthcare system. Everything is hospital.
Which is not, we spent 28 minutes talking about everything's moving out of
But
hospitals.
it's all moving out, but it's moving out very slowly. The health centers are a great progress towards bringing patients out into the community, but we still have the hospitals. And as hospitals transition to lower and lower census, we'll see more and more community-based healthcare centers, advanced practice nurse practices, more physician practices, and then slowly you'll see less and less hospitals and more community-based healthcare.
You believe that? You believe there will be fewer
Absolutely, yes.
hospitals? You believe that,
Absolutely.
Doctor?
I do.
Talk about it.
I do. I believe that the walls of the hospital are shrinking because this paradigm shift is happening. It's happening slowly, as Judy said, but yes, it's happening.
Because it's just the nature,
It's the nature
of where
of
healthcare is being delivered?
of where it's shifting to,
Where it's being paid for.
where it's being
service.
paid for.
And that's not even a good or bad thing. It's just the way it is.
Pretty much. I mean, that's the environment we're in now with this whole new system
And nurses are more important than ever before.
than ever before. And it comes at a time when, as you said, the primary care physician numbers are dropping. That's where the need is coming from.
And
There's
that's
a
not going to get
widened
better
gap.
anytime soon. Talk about that in a couple minutes, in a minute left.
Yeah, I can't speak specifically to why there's less
Just the way it
primary care
is.
physicians, it's more of specialty interest. Less people are going into medicine
it's
for
also
various and sundry reasons.
The time it takes for a physician to be prepared is many years, 6 to 8 years. So the cost is very
for that.
expensive. So I think we're going to see a lot less primary care physicians, a lot more specialties. And that's the ideal location for, again, advanced practice nurses to be in
Fill that
primary
void.
care.
Keeping people
Absolutely.
healthy.
So ultimately, as we continue to debate, why don't we have more primary care physicians? We need to have more primary care physicians. How do we change the medical school environment? All that can go on. But in the end, nurses continue to play this incredibly important role, particularly post the Affordable Care Act. And we are so glad that you and your colleagues are there every day taking care of the rest of us and serving as the quarterback and taking care of our health care. Thank you so much. Great job.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, United Water, Horizon Blue Cross Blue Shield of New Jersey, Activists in cooperation with the American Medicine Chest Challenge, New Jersey Manufacturers, the Russell Berry Foundation, and by Choose New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
You may have heard the first deadline to purchase health insurance under the Affordable Care Act has passed. The marketplace will reopen to everyone on November 15th. But you may still be eligible for coverage now if you have moved, lost a job, or if your family status has changed. And if you think you don't qualify because you make too much money or are not a citizen, you may be surprised to learn that there is a health insurance plan for you. And for those who qualify, coverage under New Jersey Family Care is available all year round.